Welcome to my podcast. Today I'm going to talk about another condition. So basically, after you introduce yourself and double check the patient name and date of birth, you find a lady bringing her child. She seems to be deeply concerned. So you'll ask her, "How can I help you today?" Basically, and what happened. So the lady will say, "I was playing with my son, and all of a sudden, he's not responding, or he started shaking, or getting any sort of jerky movement." So the woman basically, she will be frightened, she will be really concerned about her baby and wanted to know what's going on. So they will ask her, "Can you tell me more about it?" And if the lady stated all of that and then nothing further been added, you could ask, for instance, was this the first episode? How it happened? Was the kid normal before? Is he fit and well? Is he feeling okay? How old he? You will ask also if he had lost conscious, if he's not responding. And during the fit or the jerky movement, did he lose conscious? Did he injured himself at all? Did he bite his tongue? Did he wet himself? How long the jerky movement lasted for? Did he regain conscious after the episode? And what happened after then? And you will ask if he had vomited at all or not, and if he had any temperature, for instance, or any of flu-like illness before the incident. And also we'll ask if there is any rash being noted by her, or if the child, for instance, is crying, rubbing his ear, not responding, not feeding. So all of that could be pointing to upper respiratory tract infection or otitis media, meningitis. And then you will ask if there is any past medical history, for instance, in regard to this child. If she had given him anything that she might think that it could help. You will ask if there is any family history of any illness that run in the family. If there is history, for instance, of epilepsy or fits. And then you will ask, how was the child born? Was it a normal vaginal delivery? How's his development milestone? And if he's up to date with his job. So this is the main three questions you need to ask about any pediatric case condition. And you will ask her thoughts about the book, if she's happy with it at all. And of course, you need to ask if the child is feeding well and wee and poo normal, and any thought that she might have could be related to the condition happening at that time. And then you will ask her that you would love to have a look for the child and examine. So basically you will do the observation, then you will have a quick look in the mouth and the ear, nose, general inspection for the skin, if there is any rash, for instance. If the child is, is crying, if he's not tolerating anything at all, if she's febrile. So all of that could be pointing to certain situation. As I mentioned, could be otitis media, upper respiratory tract infection, and could be also meningitis. So after all of that, you will agree with the lady about a management plan according to the finding. So you will tell her if, for instance, he had any more fits, you need to record for how long they stayed, if the incident kept repeating, if it's not improving, if you feel that nothing seems to be right, you need to take him immediately to A&E. And meanwhile, you will arrange with her and agree about a management plan. So you will tell her that we'll give him paracetamol, for instance, to reduce temperature. You will advise about cooling and light dressing, and you might give antibiotic if you feel the need to do so. And also, you need to encourage her to keep feeding the baby. So, for instance, fluid drink. And during the fit, she can only help by putting the child on the recovery position, which is basically on the side, with a flexed one leg and extended the other. And this is just in case if there's any vomiting, so there will be no aspiration. And this will help also manage that the tongue won't fall back and block the throat. And if, as I say, the seizure kept going, or there is anything that could be difficult to manage, she could ring for the ambulance or 999, and they will take him, of course, to the A&E and manage the condition. That's provided if it's not improving or showing sign of improvement at all. And after all of that, you'll just, you need to safety net, as I mentioned. And if anything doesn't seem right, always tell her to call the emergency or escort the baby to the A&E, and then you will tell her if there is anything more you would like me to explain to you, and you just need then to close the case. So by that, I hope that I covered fever in children. The most common one is the febrile convention, and I see you in another podcast. Thank you.